is the Vice President of Population Health at Henry Ford Jackson Hospital, Dr. Courtland Keteyian. Good afternoon, Courtland.
Hi.
You also have another title with Henry Ford Health, Central Region, head of something.
Yeah, yeah. So I'm the president and CEO of the Jackson Health Network. So that's our clinically integrated network in this community. So that has the doctors that are both employed with the hospital and then are independent in the community. So there's about 900 providers in this region that are part of Jackson Health Network. And then I'm vice president of population health for our, for our market here. And then clinically, I do occupational medicine. So I see people in our occupational medicine clinic at the hospital too. So couple different things that I do. Yeah.
Yes, I would say one of the busier providers at Henry Ford, and thanks for taking time to be with us.
Sure, yeah, for sure.
The pandemic, it keeps rearing its ugly head, and it's doing so right now in Jackson.
Yeah, yes, we've seen things tick up a little bit, just prior to Memorial Day and now into Memorial Day over the holiday, and we had been just a handful of people in the hospital. We're back up to 20 again now, and there's a couple people, 3 or 4 people on ventilators again. So, it definitely is still just holding on at this point, and we're still testing a lot of people. And for the last month or two, somebody still dies every week of COVID here, and I think it's been easy to sort of lose sight of that. But if there's anything else happening where we were losing somebody every week in Jackson County, I think we'd be paying really close attention if it was a shooting or something else, right? But because it's COVID now, I think we've become kind of immune to it. But it is still taking a toll on folks in the community, absolutely.
Yeah, and you say shootings, and we're also immune to that too.
We're immune to that too now, unfortunately, yeah.
In the hospital, as a health system, being Vice President of Population Health, you've got to be looking at shootings as a serious concern.
Yeah, I've lost track. I mean, statistically, the numbers, it's in the hundreds, I think, this year, and already we've had mass shootings. And then there was the one that was in Tulsa, I believe, that involved the hospital. So it's things like that are unsettling for people that work in that environment every day. You want everybody, obviously, to be happy with the care they receive, and I think the providers all do their best to, take care of those patients, but folks aren't always happy, and it has consequences sometimes, unfortunately.
Well, we know both in Lansing and Washington, there are promises that our government is going to be attempting to do something about gun violence, so we'll hope and see.
We'll see.
Yeah. This morning, Governor Whitmer was in Kalamazoo to celebrate with the Pfizer folks because they are pledging to invest $250 million in a plant expansion to produce Paxlovid. So that tells me, wow, there's anticipation we're going to be dealing with COVID for a long time if they're investing into that big of a number.
Yeah, I think that's, so one, yes, I think absolutely we're going to be dealing with COVID for a long time. And Paxlovid it's a great medication. I mean, it reduces the risk of hospitalization by like 90%. So it's a very effective medication. The caveat there is that people need to get it very early. And I think that's the thing we've been seeing is by most people, by the time they think they realize that they have COVID, they've now kind of exited this 5-day window that they have, and it's too late. So it's really important for people to get tested very early on. Like as soon as they start to notice they have symptoms, they really need to get a test to pick it up and see if they have it or not, because you don't want to miss that interval for the medication, especially for somebody that's at higher risk. But yeah, that's been the main challenge I think right now is getting people the connection to their doctors, getting tested soon enough. Because Paxlovid actually has there's some complexity to prescribing it. It's not something that would ever be available just sort of over the counter. It has interactions with other drugs people might take, and so you really need a physician that can look at the medications you're on and determine, whether they need to hold certain things or think about even different therapies. But there's a whole host of medications. Paxlovid is it's a medication that's metabolized in the liver, and so lots of drugs are metabolized in the liver. So we want to make sure that we're not changing amounts in your system if you take a medication now that interferes with that liver metabolism. So it's really important to make sure that you have that relationship with the doctor, so if you get COVID, you can get in touch very quickly, and they know who you are, and they know your medical history, and can say, okay, safe for you to take it like this, or we need to hold this medication you're taking so that you can then take the Paxlovid. But that's where we're really missing right now is folks aren't getting tested soon enough, so they don't know they have it, and then their doctors don't have enough time to get it to them.
So that 5 days, that's critical. So by the time you feel like you might have, and then you test yourself or go in for testing, then what's the process? You see your doctor, your provider?
Yeah, you got to call your doctor. And some doctors may do it differently. Some may require you come in for a visit. If you have an established relationship, most of the time the doctor can kind of look at your chart and say, okay, I know you as a patient, and I know the medications you take because I'm prescribing them. So I can just call this in for you because I know who you are, right? So, so it's a little easier if you have that established relationship with a physician.
And it's a drug still only authorized under emergency use authorization, right?
Yeah, that's right. That's right. Yeah, I think, I mean I don't know where Pfizer's at in that approval process, but I'm sure ultimately this one will be FDA approved as well. It's an amazing medication. It's an amazing medication. I mean, this is something that is so effective at keeping people out of the hospital, and that's really the goal, right? Is we don't want people to get this really severe level of illness that's risking death, and it's very good at preventing that.
Today, New York Times said that a White House official has told them by June 21 they anticipate that children younger than 5 could be getting the vaccine. Is that close on the horizon?
I think that's probably true. Yeah, I know that Pfizer submitted its data to the FDA, and Moderna actually did earlier than that. So these are two. So Pfizer and Moderna are the two that make the mRNA-based vaccines that have really been shown to be the most effective. And so Pfizer's probably got a little bit of a leg up because it's already got the vaccine approved down to age 5. The Moderna is still only for adults, but likely the case that those things will be approved sooner than later for that population, which is great because that's an age group that has still been completely unprotected.
So for everyone else, have we seen a big drop off in the COVID vaccinations?
Definitely, yeah, definitely. And I think it's as we've had these kind of subsequent waves of needing to get a vaccine, needing to get a booster, that we've seen drop off. I mean, when we first did, this was now back in 2021. I remember the vaccine first came out, and we had, like, the teachers were the first people to get vaccinated, right? We had every teacher in Jackson County vaccinated within a few weeks. I mean, it was just like waves of people rolling through. So that's trickled off for sure. I think the main message there is, especially for people, so it's only for 50 and over where this is the case, but there's a second booster available. So people that have had their primary series, their 2 shots, then they got a booster, and now there's another booster available for that population of people. The immunity, whether it's from the infection or from the vaccine, we're pretty confident that immunity wanes now within kind of the 4 to 6 month time frame. So if it's been 4 to 6 months and you haven't been boosted or haven't had it, you're now really, really vulnerable again. And so it's important to go get that next booster. I'm not in that age group yet, so I'm kind of nervous. I'm like waiting. I'm like, when are we going to approve it for my age group?
Yeah, well, for me, and I say luckily I am, because I was able to get the second booster, and it's just a feeling of just to feel a little bit more protected. So in 4 to 6 months, are we going to all be doing this again? A third booster or another set of vaccines?
I think that's possible. The other thing that's being evaluated is if there's kind of a new vaccine that can be developed, and I know that companies like Pfizer are working on this now, because the virus continues to sort of mutate, right? It changes its genes, and its proteins look different, and that's why we've seen actually over time that the vaccine has, well, early on it was great at preventing just infection, and now it's much less good at preventing infection, but it still prevents the really adverse outcomes. And those are probably different mechanisms for how the vaccine works and boosts the immune system. But to really get that sort of level of infection protection, would we have another vaccine that, comes down the road? I think at the very least, this is going to be an annual thing. It should be like a flu shot, right?
Yeah.
I think we should expect this is like a flu shot.
But that's a good point you bring up, because I hear this question a lot. They say, well, with all the mutations, the Delta, Omicron has changed so much, but the vaccine, it's the same formula that we had when it was first introduced. What's the difference when we say, well, this year's flu shot, the flu vaccine this year, we have to make a whole new flu shot because the flu changes every year. So last year's flu shot doesn't work on this year's flu. Last year's COVID shot does work on today's COVID?
Right now it does, yeah. And the main difference is in what's called really the strains of the virus. So with influenza, there are, gosh, I don't even know, probably thousands of strains of flu virus. And so it takes quite a long time, months, to manufacture flu vaccine in the quantities needed to deliver it during flu season. So the scientists at these companies have to basically agree upon what they think the most likely strains will be that are circulating in the fall and in the winter, in the spring. So they're working 6-8 months in advance to really say, okay, here's what we think is going to circulate. We're going to build vaccine to this. With COVID, there's actually not quite as many strains, even though we keep hearing about all these different variants and mutations and things like that. There's not nearly as many as there are with the flu virus. So you still get pretty good coverage from the vaccine in COVID because it's still a much newer emerging virus it is compared to the flu. But I don't think it's unreasonable to expect we're going to have kind of a similar process in the future if we have more and more strains of COVID virus that are all these different variants and subvariants that we're getting.
Testing. Right now, in many places, no system for sharing test results. You test yourself at home. Nobody calls that in anywhere.
That's right.
Are we missing something in data collection by not knowing really?
Absolutely. Absolutely. I mean, this happens with this is an issue, I think, for public health and our health system in general. We don't have, we're not China, right? We don't have like the government testing everybody and then seeing everybody's results. It's just not how we operate in this country. And this is true for even like the flu we were just talking about. In a normal flu season, somebody might go to their doctor and get a flu test. There's not a home flu test like there is for COVID. But that test result doesn't really get reported anywhere, right? That's just that they know that's the result, and then they might treat that patient with a medication for influenza. So it just kind of depends. I think what we do here, which is a little different, is we actually kind of take a sample. So the CDC conducts what's called surveillance, and so it's more of a statistical estimate of what we think prevalence is, because they can sample from different parts of the country and say, okay, this place we're going to actually really monitor how many tests that are results that we're getting that are positive. We can use that to project how much there is, but we don't have like an actual number like they have in a place like China where it all has to be reported. So that's important for us when we look at like county numbers, and right now there's about 1,500 active cases of COVID in Jackson County that we know about.
Yeah,
that's what we know about. Yeah, that's what we know about. So, when we're doing testing at the hospital here, something like 30-40% of our tests are positive. So that tells me that there's still a really high number of cases in the county. We just don't know about them. And earlier on, when we didn't have these home tests, we had a much more accurate picture of how many cases there were, because people would be coming to us to get the test. If a test is conducted in a health system, we still report those cases. So whenever somebody comes through our drive-through testing, those all get reported to the state. So those are tracked. But the home test, there's no way to know.
No, and I think a lot of people just mistrust the home test because, well, you've seen it. It's, all these instructions and cutting and pouring and dipping and testing and, swabbing, and what could go wrong? Anything.
Yeah, it's, in my own home, the COVID case that happened there recently, we tested twice with a home test. It was negative twice on a home test. And I said, this looks a little bit too much like COVID. I really think we need a PCR, and the PCR was positive. So it was a week before we had the actual diagnosis. Thankfully, because I know the symptoms, that person was quarantined and didn't expose anybody else. But it is really important, I think, that if a home test is negative, to not necessarily take that as fact, and still be, still make sure to get a really, like if this person's sick, or if these symptoms are really consistent with COVID, and COVID is that kind of flu-like illness, upper respiratory symptoms, cough, congestion. Everybody thinks they have allergies right now. It's not always allergies. It's not a bad idea to get a PCR test and make sure that that's not what it is.
See, even with the doctor in the house, you can still get a false positive, false negative.
We got false negatives. But you're right. It's the same thing, right? It's we're take the swab, put it in the vial, add the fluid, swirl it around. And I'm like, I don't know if this is going to work.
I know. I can't believe it. It's like,
wait 10 minutes, not 11. It's
right.
You have to be very precise. Yeah.
Don't look at 9. If you look at 9 minutes, it could be.
Yeah.
And then you turn the box over, made in China.
Yeah.
All right. So you mentioned allergies. It seems like this year's allergy season is it ever going to end? It started early, it's still going on.
Yeah, I know. And it just adds complexity to this thing with the COVID, right? Because everybody's got, at least right now, people have potentially another excuse. When folks said they had allergies in January, it was like, okay, guys, I mean, I think we definitely need to get a test. But yeah, at least, and there's medications for that too, right? So talk to your doctor, whether it's COVID or your allergies.
All right, your doctor will know for sure.
Yeah.
And if not, they can test. Thanks for all the information.
Good pleasure. Yeah, good to see you too.
Thank you. Vice President of Population Health with Henry Ford Jackson Hospital and President and CEO of Jackson Health Network, Dr. Courtland Keteyian.